Hello and welcome to this special edition of NJ Biz Conversations. I'm your host, Jeff Kanige. My guest today is Mark Sparta. He is the President and Chief Operating Officer of Hackensack Meridian Health. Mark, welcome.
Thank you, Jeff.
Thanks for joining me. I too appreciate you taking the time this morning. First of all, congratulations on opening the new wellness center and headquarters at Metropark. Looks like a fantastic place. I love what you've done with it.
Exciting, really a very special place, and we're really happy to be here serving the folks at Metropark.
Okay, very good. And there was a ribbon cutting ceremony late last month, and we heard a lot about the origins of the facility there. For viewers not familiar with the thinking behind the project, what does it mean to Hackensack Meridian and the region?
So it's terrific for the region, and whether you're a commuter, whether you're a resident locally, or whether you take the bus or train to work, either to Philly or to the New York City. We're here providing incredible access to care, world-class care that Hackensack Meridian has become known for. And we really believe that bringing care to where patients are is going to be the secret to success for good health for our communities in the future.
Okay, and indeed, that is something, that phrase, bringing healthcare to where people are, has been something I hear over and over again, both from your colleagues at Hackensack Meridian and from your peers in the industry. It's a way to improve access to healthcare. Given the affordability on focus right now, how would you explain what access means, especially for New Jerseyans right now?
So I can tell you that, historically, access has meant living in a zip code or an adjacent zip code to where a hospital is.
Okay.
And that has usually meant a waiting room.
Right.
Waiting rooms are not good, and
No.
hospitals as a primary point of access to care is usually the most inefficient and the most costly place to receive care, specifically in ERs. So our goal is to construct a network of ambulatory care facilities that is so dense and so accessible that every New Jersey resident lives within 15 minutes of that type of access to care. We can provide care in a much more cost-efficient, a much better patient experience than going to a hospital ER out in the community. And it's much more convenient for patients.
Okay, and the Metropark piece of that is that it's near a train station, obviously, and there's transit options. Folks can, if they're commuting to work, they can stop in and do that. And you mentioned going out into the community. Can you tell? Is there anything else going on in that regard about getting out into the community, about being where people are? I know I've talked to a lot of folks in the industry about bringing the hospital to where people are. What else can you tell us about what you're doing along those lines?
So in addition to the bricks and mortar investments that Hackensack
Right.
Meridian is making, close to $500 million of investment, either that's been completed or is in the pipeline to be completed. We also know it's not all about bricks and mortar. Some patients prefer the convenience of access through virtual visits. And, we're providing access 24/7 to patients through our virtual care network, HMH 24/7. But in addition to that, even patients that meet inpatient hospitalization criteria with lower complexity types of conditions, we're extending what we call hospital from home program, where patients are actually monitored virtually, have access to their care team virtually, but also receive in-person follow-up and visits in their home. Who wouldn't want to be at home if they could be at home, receiving the same level of care that they could be receiving in an acute care facility?
Okay. Well, yeah, thank you for rephrasing my very inarticulate question. That's exactly what I was getting to, so I appreciate that. And that brings me to the next subject I wanted to cover, and that is the use of technology. Your CEO, Bob Garrett, has been in the forefront of thinking about how to use AI and what it means. From your perspective, how does technology fit in? You mentioned using remote visits. What else does technology do for you? I'm thinking particularly in about some of the challenge that you face, the workforce challenges, the overwork of professionals, nurses, physicians. How are you using technology now? What is the latest you can tell us about what you're doing there?
Sure. Let me first say, Bob has truly been a visionary in terms of innovation and early adoption of technology. Um, you know, we look at AI through a different perspective, I think, than a lot of other organizations look at AI. From my perspective, artificial intelligence gives us the opportunity to leverage all that it brings to the table from a workforce administrative burden standpoint.
Right.
You know, our caregivers, whether they're nurses or whether they're physicians, they want to be with their patients. They want to be at the bedside, spending quality time with them, providing the best possible care that they could receive. And unfortunately, you know, the administrative burden around charting and coordination of care activities often pulls them away from the bedside. We
Okay.
believe that AI clinically is going to be a terrific tool. It's not going to be a replacement or a substitute
Right.
for the human touch and compassionate that human provide, but I like to think of it as a dual human factor. The first human factor is that it allows us to put the humanism back in healthcare, but it also will reduce the likelihood of human error because AI does what it does the same way every time. So in terms of chart summarization activities, we have pilots going on where we can use AI to be able to ensure that the same information is communicated to the next level of care rather than relying on the human element of determining what information is important to communicate and what doesn't need to be communicated. That's just one example. It can help coordinate care and navigate care, which we know our systems are really, really challenging in the US to navigate for patients, but can help facilitate that. I really think it's going to help our workforce challenges in the future because it'll put the joy back in work for providers, you know, who have been really burdened with a lot of administrative activities, given the regulatory environment and electronic charting requirements.
Okay. You mentioned brick and mortar, though. Given the facilities that you're opening, I mean, I walked through the place at Metropark, and you can tell that technology is in the forefront. I'm guessing that's a part of the calculus as you open some of the ambulatory care facilities. Obviously, the place at Metropark, technology must be front and center. Yes.
Absolutely. You know, if we don't keep up with advances in medical science and innovation and technology, we won't be best serving our patients. And we'd like to stay on that cutting edge to ensure that not just our providers benefit from the technology, but obviously those who entrust their care to us, our patients.
Right. Okay. Now, you've been in the business a long time, I think 3 decades at Hackensack Meridian Health. Given your experience and all the changes you've seen, what do you see coming in the near future? I mean, what is the experience going to be like for a patient coming to HMH or receiving care from HMH professionals at home or at some other place? What when you think of the next 3 to 5 years, what are you envisioning?
So I see a world where far fewer families actually lose patients to diseases that we already know how to prevent and detect. Mm-hmm. I think that we can manage chronic conditions much more effectively and help patients avoid unnecessary hospitalizations through better access to care, better monitoring, and use of technologies and innovations. I think that the future is bright for health systems and HMH who look into the future and utilize all of these new tools that are available to us and really optimize the patient experience.
Okay. And that actually leads perfectly to the last thing I wanted to ask you about, which was sort of your general assessment of the outlook for both Hackensack Meridian and the industry. I hear you saying that the most successful systems are going to be those that embrace the kinds of things that you're talking about. In general, though, how do you feel about where things are going, both, as I said, both for you folks and for the industry as a whole?
I think it's incumbent upon us who have been recognized as system leaders within the nation to focus on affordability and also focus on utilizing all the tools that are available to us to improve quality and increase the value of care. Affordability is a huge issue. You know, a Gallup poll recently showed that 1 in 3 families are actually making difficult decisions in order to pay their healthcare expenses. And it could be that they're traveling less, trying to save on fuel, or being more selective in terms of the meals that they eat and the type of food that they purchase. So I think it's really important that we look at our model of care and look at our access and ensure that we are optimizing all of our providers to the highest degree of their license capability. We can't create more doctors in a timely enough fashion in order to address the shortages that are on the horizon. We have to ensure that nurses don't burn out. Thousands, hundreds of thousands of nurses have left the profession since the pandemic, and without doctors and without nurses, it's really hard to care for patients. So we need to make sure that we take advantage of all of those levers and ensure that we turn that care model into something that's more efficient, more effective, and safer, but it'll actually cost less. No. So I think that's going to be the secret to our success in the future. And I think at Hackensack Meridian, we've been working on some critical strategic plans in order to pull those levers to ensure that we deliver on our promise to the community.
Okay, well, there's a lot riding on it, and I think that's a good place to leave it. We'll keep an eye on how you're doing. Mark Sparta, President and Chief Operating Officer of Hackensack Meridian Health, thank you very much for spending time with me this morning. I really appreciate it.
Jeff, thanks for the opportunity.
Thank you. Thank you for watching. Until next time, stay safe, everyone.